Hello, everybody.
Hello.
Oh, wait a minute. Julie, do I have to wear a mask for a Zoom meeting?
No, but Amy and I share the room, so she can take minutes, so we have to, unfortunately. So,
Okay, well, I'm willing, but I'm alone, so,
yeah, you're good to go.
okay.
But we do. So. In order for her to take minutes.
Gotcha.
All right. Mm-hmm. She said pelvic. Yeah, I cracked that. Yeah, I totally.
You guys want some cat food? I think you got some dinner. I got other cans opening.
Whitney. Whitney? I don't know if it's the same one. Alrighty.
Good evening, everyone.
Good evening. I'm Krista, and just to let you guys know, I'm wearing a mask because Amy is in here. So, can you guys hear me?
We hear you.
Okay. I'm not sure.
Just see if we have everyone join us. There's a few more people still logging on.
Yep. Mm-hmm. Let me find that here. Okay, there we go. All right, people.
Julie and Amy, have you heard of anyone that won't be able to join us this evening as far as board members?
No, no one has said that they couldn't. Krista, can you see the little participant list? Can you see the participant list, Krista?
It's there, Krista.
Krista can't hear me.
Dr. Peterson, is that you at 841?
No, I've already let them all in.
Am I in?
You are in.
Great, thank you.
Oh, now I'm hearing sound. I'm sorry. Can you repeat that?
Me?
Okay. Yeah, I'm sorry. My sound cut out and whoever was just talking, I didn't hear the whole thing. I'm so sorry.
I was just wondering if you could see the participant list.
Yes, I can see that now. I
Okay.
see David, Dr. Vera Weiss is here. And Dr. Peterson, was that you at 841?
This is Mandy. It's probably me.
Okay.
841-2456.
Yep.
Yep. Okay. Just want to make sure so it looks like we're still waiting for Julie, Dr. Peterson.
Who else?
Maybe Kathy Emmanuel.
Yes, that's it. I was going down the participant list. Thank you, Dr. Vera Weiss.
You're welcome.
Kyle's on.
Yes, I had not heard from anyone else that they would not be able to attend, and it does appear that so we do have a quorum. So I think we could start and then hope that those other individuals will join us subsequently.
I'm not recognizing everybody's name, and so we need, how many do we need for the quorum?
Believe we need 5.
Okay.
We have Kyle, myself, you, David, Bradley's on.
Good.
Okay.
Well, good evening, everyone. Glad to see so many wonderful faces this evening. I'll go ahead and turn it over to Amy. If you would please, Amy, call the meeting or call the roll call, excuse me.
Dr. Jones,
Here.
Dr. Kumar, Dr. Peterson, Bradley Clemens,
Here.
Kathy Emmanuel, David Thies,
Here.
Dr. Vera Weiss,
Here.
and Dr. Fleming.
Here.
Thank you, Amy. I'll move on to the approval of the agenda. Do I have a motion to approve the agenda?
Move approval.
Second.
Thank you. That was David and then Dr. Vera Weiss, Amy. So moved and seconded. Any discussion on the agenda? Hearing none. All those in favor?
Aye.
Aye.
Any
Aye.
opposed? Any abstentions? Thank you. That takes us to public participation on those agenda items. I see we have several individuals on the call. Do we have any public that would like to speak to the agenda item?
I have not seen the agenda items. Are they on the screen?
It is not on the screen. The only agenda item is an update on COVID-19. That is the only agenda item for this evening.
Okay. May I speak?
Yes, please.
I'm Michelle Yarbrough. I own Sunsinger Wines in Champaign. And in fact, we just had a public health inspection last Thursday with Remy. And I had some discussion with Remy about the future seating charts as they might look when that becomes available to be able to do that. So trying to be proactive in the approach. I submitted to her to bring to you, Julie, into the office to a meeting, the proposed seating chart showing proper spacing as required. And also a question about whether or not the patio would be treated separately or differently than the inside space that's more air restriction.
Okay.
Have you seen that yet?
I don't believe I have. She probably showed it to Jim and Sarah. They're the ones that, they're working on putting together the guidance for all of that.
Okay. Well, I thought that might be instrumental in helping kind of get our perspective as to
Yeah.
what's possible and what's not possible. Well, the big question I had for them was what type of screening might be necessary in between, and whether whatnot we could use pipe and drape and with a cloth, or if it has to be a washable surface, or all these various aspects that will take some time to develop.
Yeah. Okay. That sounds good. I'm guessing that it's going to probably be the non-permeable cloths. That's what or non-permeable surfaces, but I'm not positive. But we
Okay.
are getting together a lot of things, and I know that the city of Champaign is working with trying to get sectors together to help develop the reopening plans. Because we'll just end up reviewing them, but we hope to have the sector plans together. So I will ask Remy or Sarah, probably Sarah, to get that and look at it.
Okay, very good. If I could give any other assistance in that, whether or not we need to put a formal plan together with text and so on, or whether the basic initial drawing is good.
Okay, yeah, I think what we're going to end up doing is having, and probably you just did a whole bunch of work for a lot of other people in that sector, because it sounds like you did. So we'll put those together. The sector will come up, meaning like, restaurants and gyms and different places. We'll put together a plan, and then we'll approve one basic plan. But it sounds like you have some good questions in there that we'll need to think about, like the outside space versus the inside space. So that's good. Okay, thank you. I appreciate that.
Very good, thank you.
Okay.
Did you have any other questions or any other comments?
No, not really. I think other than getting some information back so that we can start to develop a full plan, we already have the table spacing spaced out, and that's ready to go. So it's a matter of what other equipment might be required.
Okay, thank you.
Thank you. Anyone else that would like to speak from the public?
Okay.
Looks like we have someone else signing on here. Just checking to see who that is. Okay, hearing no other comments from the public, I'll move to correspondence and communication.
Nothing. I'll just go on to the COVID update. Well, you have have I sent you anything, Krista, that needs to correspondence wise? Other than you got a letter from the gym about reopening. It's in St. Joe. They were told that they could not reopen. They reopened anyway. We did a cease and desist order. Then now it's the state's attorney has it, and they got a temporary restraining order, and they're looking at the next step. And that's it. That's it for correspondence.
Any questions for Julie on correspondence? Okay. That takes us to our agenda item, which is an update of COVID-19.
As of this afternoon, we have 412 cumulative cases. The county has done just over 8,609 tests, or have done 8,609 tests. We currently have 188 active cases of people who are in isolation. 4 are currently hospitalized. As you know, we've had 7 deaths. 34% of all cases right now are in the county outside of Champaign and Urbana. And we are currently working 19 outbreaks. We have 7 in food service, 2 in long-term care, 8 in manufacturing and construction, 1 in a hotel, and 1 in a store. We have over 700 people right now in quarantine and the 188 in isolation. So we are ungodly busy, as you can imagine. That's a lot of outbreaks right now. Obviously, the big one is the Rantoul food one. But we have, so, eight in those type of, not those type of facilities, but like manufacturing or construction. So we have them kind of in sectors. So the thing is, you cannot possibly keep a case out of every place. You just can't. So it could come in on an employee anywhere. But if you have really good infection control practices in place and you're vigilant about it, there is no need to have an outbreak in a facility. And a lot of places have had 1 case. We have like, that's like the pre-outbreak. You get 1 in a facility. We've had lots and lots of those and no spread. So we have lots of really good infection control out there, and then some that didn't start so much until after the outbreak. So obviously all of these outbreaks are in places that are considered right now essential, because that's the only places that are open. So that's what we're dealing with right now.
And Julie, at this point, can you advise, has everyone at the facility in Rantoul been tested at this point? Have all employees been tested yet?
Well, that's just a good question. We are having all kinds of issues trying to figure out that question, because apparently a lot of people on the list, maybe up to 200, were not actual employees there at the time. So we believe so. But again, you have to remember that a test is only a point in time thing. So let's say we had 700 employees tested or 500 or whatever. They can still, anyone who is tested positive is, obviously a case, and then they were put into isolation, and then the others were put into quarantine that were close. But we can still have outbreaks, but hopefully with the infection control practices that are in place now at Rantoul Foods, hopefully that we won't have another one. So that's kind of key, because no place can keep, because you can't control what people do outside of, your job or whatever, but so you can always bring it in on an employee. But if you're doing infection control, then it won't spread around, and you won't have to close your business due to lack of employees because everybody's in isolation or quarantine. So.
Thank you. Can you advise on what expenditures are being realized in the county in terms of hiring? I know that there's been some translators that need to be hired, and there's also some costs associated with hotels and isolation. If you could speak to that. Yeah,
there are some. I don't know exactly how many people right now are in hotels. Not a lot. That's not so much of a big. That's not such a big thing, because a lot of times, by the time we get the person that's infected, they've already infected their whole household. So that's a problem. But most of this is going to be spent on staffing. The vast majority. We just had to turn in, hopefully we'll get more funding. I just turned in a thing today, pre-survey, to get more funding for the contact tracing, because we're doing that 7 days a week and do it till about 7 at night. And so it's going to be mostly staffing, but we have had to hire Lingala, French Lingala speakers, and to help with the contact tracing, and also Kanubal language. And then we had to move all of our Spanish speaking staff from other parts of the agency basically into the Emergency Operations Center for this, because there were a lot of Spanish speaking staff at the Rantoul break, and then in the families, and then some of our subsequent outbreaks will likely have that as well.
Julie, have you had been able to do testing of all members of families of people who are positive at
Yeah.
school and others?
Yeah, so what happens when somebody has a positive case, they will get a call from public health. We do the case investigation, contact tracing, refer all their people in their household to testing. And then, and by the way, a new testing site has opened up at the mall as of tomorrow. It will be 7 days a week, 8 to 4. It's at Marketplace Mall up by where the old movie theater used to be. It's drive-through. Anyone can use it that is basically anyone who's working right now can use it. And then anyone who is at high risk can use it. And anyone who has symptoms can use it. So it's just a matter of going up there. And here's the important part for people. It does not require a nasal pharyngeal swab. It is just a nasal swab. So the doctors on the phone can appreciate that. But what that means is you're just going to be swirling it around in your nostril and not shoving the stick all the way up into your, what feels like your brain, but it isn't, but it feels like it. So that will make testing more palatable for people, I believe. So hopefully that's going to help.
I know.
So we still have in the county, we still have Carl doing 12-hour days, 7 days a week, testing drive-through. Christy, Francis Nelson Health Center, OSF, McKinley Health Center, this new site, and also Campus Town, urgent care on campus. So that's all the testing sites right now.
Julie, I have a question.
Mhm.
As our focus is shifting slightly now towards what an appropriate way is to reopen, so-called reopen, I remember that, or it seemed to me that a reason, maybe not the only reason, but one reason for the shutdown was to flatten the curve. And the reason we needed to flatten the curve was our medical facilities were not equipped to deal with what we projected might be the surge. So we've been in lockdown, and we have, I think, flattened the curve to various degrees, depending upon where you are. And so my question is, are all the things that we were saying we didn't have but needed to acquire, and that's why we needed to flatten the curve, have we made good progress in doing that, so that the analysis of when to open up, somebody needs to,
Can I please ask everyone to mute? Thank you.
how are we far enough along in the process of flattening the curve that the analysis of the reopening might be different than it was 2 months ago?
So, so certainly having, a large outbreak doesn't help, but the good thing is the hospital capacity is still really good. They're starting to do surgeries now, so that's going to decrease the hospital capacity. So if you read the Restore Illinois plan, you'll see that, again, the major thing that we're trying to do is maintain the hospital capacity so that we don't have cascading series of horrors. But so far it is looking good. We have really good capacity at the hospitals, both of them. So it is a regional thing. So we're region 6, and we're just a piece of region 6, but the biggest piece of region 6. And then you go over to all the way over, across the state. So it's really region 6 and region 3 together. So if you want to look at the Restore Illinois plan, we are region 6 and 3. We're called the central region. But so far, so good. Because even though, we're getting a lot more positives, we have not had a lot of hospitalizations. Now, if you look at the age curve, you'll see that the vast majority of these cases are in younger people. So it hasn't required hospitalizations yet, and we hope that holds.
The implication of, if the only reason for the shutdown was to allow for, to make sure that our medical facilities have the right abilities, the right equipment, et cetera, then the implication of that is that even when even when it's horrible and we're trying to actually find a cure, find a vaccine, do all the things we're doing, that we are willing to tolerate a certain level of infection in the interest of keeping the economy, keeping the society going. And so from a public health point of view, that does that change your view at all? Or is that?
No, here's the thing. So you can see all the cases that we have right here in Champaign County, and I think we got on this early. Champaign County, as you know, had a really good pandemic preparedness plan. We've worked on it with all of our partners for years and years. The real issue what we're having, one of the really difficult issues is the personal protective equipment. That's a really big problem. It's a limiting factor. It's a factor here that's a problem. We have dentists calling us from all over the place. We have salons and places and restaurants that when they open up, they would like, PPE. It just doesn't exist to the point that we need it to. So what we're talking about there specifically is N95 masks. Those would be for the hospital staff and for dental staff, because the concern, of course, with doing dental procedures during COVID is it aerosolizes. You're in the mouth. You can't put a mask, obviously, on somebody you're working on. So it aerosolizes. And then we have to have our dental staff either in cappers or at the very least, N95 and face shields. So it is a problem. It's actually causing medical centers and dentists and different things to kind of compete against this stuff. So that's really right now one of the most limiting factors, I think. But the rest, the hospitals, just so you know, the hospitals have their ability right now, just their normal abilities. Then they have expanded beyond that. So they can, within their hospitals, actually expand beyond that. Then should we need it during a second wave, then they can expand bigger over to the ARC or some other place. So their capacity is good. The limiting factor right now is PPE. And of course, if we start seeing an increase in cases that in sicker people or in older people, or we start seeing younger people with problems, then that could start to cause the healthcare system to be overburdened a bit.
Well,
Did you watch where he started them in
I
there?
have a question for you, Julie.
Uh-huh.
We need to mute if you're not talking, mute your.
Yeah, if I can ask one more time, there are several individuals on the call that are not mute. If you could please mute. Thank you so much.
And then who is asking a question? I'm sorry.
It was me, Brad.
Bradley?
Yes.
Hi, Bradley.
Here's my question for you, and I may be way out there, but depending on what happens Wednesday with going on with the governor and stuff, and if this gets found unconstitutional, that this stay-at-home order is illegal, can't happen, is there any fear of recourse from businesses that we have shut down for losing their income when this is found, if it is found unconstitutional, just looking forward?
I don't, that would be a question I would have to ask to the state's attorney's office or to, an attorney. Because I don't know. I haven't even looked into that.
Well,
I don't know.
With immunity, I think that
Yeah, I mean,
you're not exposed to very
yeah.
significant liability.
Well, wouldn't the health department itself and the county be liable? Because, I mean, we're the ones that shut them down.
No.
You should get an opinion on that. I don't think that's true.
No, I'm asking the question. I'm just asking the question. I don't have an opinion on it.
I'm going to let David answer that since he's.
Generally speaking, there's at least a qualified immunity that comes from governmental activities. Doesn't mean that we aren't supposed to do the right thing. We from a legislative point of view, we're supposed to do the right thing. But generally speaking, I don't think you face liability for something like that.
Yeah, because, we're certainly following the order and the guidance and stuff. We're not going out there and going rogue and doing other things. Did anybody else have a question?
Yeah, I had a follow-up to David. I don't know how to do it.
I can't hear.
We need to, can you get closer to your microphone?
I'm sorry, is this a question from the public? Can you you identify yourself? Because we do have public participation after the board has finished. I just can't see who's asking the question. I'm sorry.
Yeah, I think he's a member of the, Cody Moody, a member of the public.
Hi, my name's Cody Moody. Can you hear me now?
I hear you.
Yes.
I hear you. Great.
Thank you. Now we can hear you.
Was that a yes?
Yes.
Yeah, I just had a follow up to David's. He was asking. So my name's Cody Moody. I'm an educator in Champaign County. I work in the Fisher School Districts. He was asking about flattening the curve, and that was one of the kind of assumed reasons we were quarantining, and flattening it for the resources in our hospitals. And then you started to elaborate on the PPEs. Are you saying that our hospitals are not getting the personal protective gear? I just didn't feel like his question was answered there in relation to other businesses. I didn't understand the correlation between the personal protective gear being necessary to open other businesses, and how that would affect the hospitals from receiving their personal protective gear if a restaurant opened or a salon or something like that.
Oh, okay. I'm sorry. Yeah. So correct. That does not have anything to do with that. So one of the, if you look at the Restore Illinois plan, you'll see that one of the things on the dashboard has to do with PPE, that they have to have enough to do services. What I was just talking about, that in general, if we had, unlimited PPE, we could do all kinds of different things, because there would be more, we get calls all the time from places wanting PPE. We don't have it, and they can't get it either. So salons are that's going to be one of the first places that open, and they're looking for it. But that doesn't have anything to do with the hospital. The hospitals are its own thing. But the thing is that all the hospitals and things are competing against each other, including like our dentists. So even our dentists at Public Health. So early on, we gave all of our N95 masks, for example, to the hospital when they were having so many hospitalized cases, and doing the swab testing and stuff. And a lot of places did that. But no, they're not related. It's just that we don't have it for the other places.
So am I correct in understanding that David's question was, now that we have a control on the capacity availability of hospital services, I was assuming David was asking, okay, so now we have it under control, and we had a threshold of infections that we thought we could tolerate, then what's keeping us from opening? I thought that was kind of the insinuation from David's question.
That was my, I'll just elaborate. That was my question. But it was, Julia, to give you the opportunity also to, there are other reasons that we were doing it, but if one of the reasons was to flatten the curve and we've done it, then what's the benefit of that? What's the consequence that comes from that?
Okay, so first of all, if you look at our cases, we're getting a ton more cases, obviously, and that's not going to change probably. We hope that, it's going to get into other communities and stuff. We can't do much about that. Our 19 outbreaks that we're currently that we're currently working on, you have to remember that these are in the businesses that are already allowed to be open, and that they are, they already have all of their infection control plans in place and everything. So the more you have, the more, we have to, when we go to the next step, then we'll work with everybody to make sure that they have their infection control in place. But there's finite resources. There's literally only so many everything. There's only so many people to do the work. There's only so many hospital beds. There's only so many everything. So that's why but we don't get to just randomly say we're going to open our county.
Okay, I have another one for you, Julie.
Uh-huh.
Brad again. Can you tell me what the difference is by 200 people being in Walmart, Meijer, Target, but Pard's Western Wear can't open up, and I would say they have less than 100 customers a day.
Mhm.
What's the difference there? Why is
Because it is essential, according to the executive order, Pard's Western Wear is not essential. Grocery stores are, and unfortunately, even the big ones like Walmart and places like that. If I had my way, Walmart would be you would only get to go to get groceries there. Same thing with Target and everything else. So I would rather see it just the opposite, not expand it to more. So it's groceries, it's pharmacy, it's hardware. It is not clothing right now, but things now at the end of the month, of course, things are going to then open up.
but my question for you is there's a lot of small businesses out there that don't have I mean, essential or non-essential, it doesn't matter. We're killing our businesses here in town. And
Okay, well, I didn't make the law. I don't get to make, make it, I didn't make the law. We're doing what we can to follow it.
I get that, but in the same respects, you're the one ordering the cease and desist and everything else. I understand.
I'm doing that because they're not deemed essential services. We're trying to have the things open as they're laid out to open.
Yeah. The problem is,
I just wanted to recognize that Kathy has joined us.
Yes.
Thank you. Yes, David, go ahead.
it's very hard to appreciate this and to endure it if you're not on the essential side of things. But the answer to the question is that you start from the premise that everything should be locked down while we deal with the problem, and then you go to what are the things, what are the exceptions to that? What are the essential things that need to be going? Not because we want to keep our economy going, but because there's food that has to get on people's plate and there's medicine that has to be sold. That's the problem. If you don't look at it that way, then you're going to say that there's a big difference. There's no difference between Walmart and Pard's, but that's not the way the law is written.
There is no difference between them.
There is if you look at what's quote unquote essential, and as a society, as a community, we define essential in a very limited way. Who sells food, who sells medicine, who does those kinds of things. That's what gets on the essential list.
But this business is essential to those owners of these small businesses.
Well, of course. Well, every from that point of view, every business is.
Yes. And yeah, it's not like it's my goal just to be, hateful and make people's lives miserable. That's, I'm just trying to do my job here, and that is to follow the executive order and make sure that everybody in our county is doing things, the same.
So I have another question. This is Cody Moody again.
Mm-hmm.
Is there any, I guess, advice that the local health departments are able to give Governor Pritzker or the people making the decisions?
Yes.
There, like you're saying you're trying to enforce the executive order, and that you didn't write the law, but I would say that, I don't know that it is a law that Governor Pritzker initiates this executive order, but at the same time, it's not gone through legislation, and I understand that you have to follow chain of command and do your part as an employee of the government here. But are you able then to also give advice
Yes,
up the chain of command?
Yes.
And or is there any collective voice from downstate's public health departments, local health departments collectively? Are they saying anything like, hey, maybe we need a different way? a different route.
That's why, how we got the regional plans, actually. Yes, there are administrators all over the state. We meet regularly, and I'm also on the State Board of Health. So it is discussed frequently, but you know, the fact is we are in the middle of a pandemic, and the pandemics are very hard, especially something like this. It's very difficult. There are no great choices that meet everyone's needs, unfortunately. So it's constant balance. But yes, we absolutely do get information up to the director of IDPH and then to the governor as well.
I got one last question for you, Julie. Smile Healthy, is that not doing anything right now, or when do you see that picking back up? Our Smile Healthy program.
Yeah, they're in the same boat as we are, pretty much, doing emergency services only. They are starting to look at reopening a little bit, but again, the limiting factor is the PPE. Because the dentist and the hygienist have to have respirators. So that's, you know, that's what we're looking at. I know all dental programs are looking at the same thing. How can they keep the staff safe while doing the services that we do? Because in our case, you know, kids need dental care for sure.
Yes, and it sounds like there's going to always be a shortage here for the near future. When do you see Smile Healthy being able to pick back up?
That's a question for them. I don't know. I don't know what, I haven't looked at that. That's not,
okay.
You guys could ask them that.
Thank you.
You're welcome.
Thank you, Bradley. Are there any other questions from Board of Health members for Julie?
It's not a question as much as it is a comment, Krista, but I'll just, to Cody's question, I think it's worth, and Julie, you know this, what I'm about to say, but it's worth saying that we really are blessed in this community with the capacity that we have in our healthcare facilities. And so Cody asked, can we influence or can we give a recommendation? At a minimum, I think it's important, and I believe Julie's doing a good job doing this, that the state officials know that we have that capacity and that we are adapting. And to the extent that the criteria included flattening the curve, this is the reason for my original question. If the curve was to be flattened, and now we've had the passage of time and the curve has been flattened to some degree, then the criteria for evaluating when to open up again can be modified. I agree with Julie, by the way, that's why we got the regional approach. Governor Pritzker's approach is both regional and it's phased. And there are criteria, and when you meet certain points, we open up. And part of that criteria is what's your capacity. And all I'm here to say is we're really fortunate in this part of the state to have great facilities and a great capacity. But that ought to lead to, at the state level, a willingness to open up sooner than we originally were thinking. That's my point.
Thank you, David. Any other questions? Yes, Dr. Vera Weiss.
You're on mute. You're on mute.
I think she's getting it.
Thank you. I just am cognizant of the fact that we still definitely have community-wide spread, which is spread among people who don't know that they are infected and can infect other people. And we have a lot of folks who are susceptible to the serious complications in the community, both older folks like me and people with diabetes and people who smoke and people who have chronic lung disease. And so I think that it's really a tough balancing act that's happening right now. The fact we have more testing will help to give us surveillance on what's happening, but it doesn't necessarily help us and it's going to be really useful. It's going to make it look like we have a rise in the slope, that we have more of a peak coming up again, and it's going to be a challenge to put it all together. But I would love it if the economy could get back to work too, but I really respect the need to go ahead and make sure that we're protecting the people who are susceptible to serious conditions, and that includes decreasing community spread so that they don't get exposed.
Yeah, one thing that we've actually found out during this is that it seems like a lot of the businesses that are allowed to open right now, it appears that the outbreaks, you know, let's say you work at a store or something, you get a person in there, what's happening is that they may be well protected in their, you know, like the stores have done a really good job. They've got plastic up, they make people wear masks when they come in, they're doing a real good job. But if the coworkers, whether it's on a construction site or, you know, manufacturing or a restaurant or anything, if they then go on break together and let's say they smoke and they take off their mask and they're standing around smoking close to each other, you're going to have spread. So we're seeing that this taking breaks, taking lunches, hanging out together after work, even in the parking lot, you know, those are all opportunities for spread, and we're seeing it. So we'll have to, that's going to be more of like an educational thing, because I just don't think people really thought about that. I know, you know, with the first responders, they were all focused on getting it from the public, but they weren't focused on getting it from their coworkers. And that's indeed what happens a lot. So. Yeah.
Thank you, Julie. This is in follow-up to our previous meeting with the county board last month, and follow up into the allocations regarding the fund balance. Do you anticipate needing additional funds at this time beyond those funds that were allocated previously?
No, not at this time. You know, we'll have to see as we move forward, because, you know, I'm honestly nervous about the winter, which I think a lot of people are in public health. Typically the second wave, and just historically, is worse. And hopefully in our community, we will be used to all of the measures that we're doing, and that will help. But yeah, so.
Thank you.
Mm-hmm.
Are there any other questions regarding the update of COVID-19?
Again, I feel compelled to mention to everyone on the phone why I'm wearing a mask is because my colleague Amy is sitting here taking minutes right by me. So I'm not like so insane that I think I need to wear this on a Zoom call, but
Not a problem.
Thank you.
Thank you. Yeah, I was wondering that. Chris, I do have another question.
Yes.
So I teach at Fisher High School, and then this might be a question that's way far out there right now, but Champaign Public Health, any ideas on public schools in the fall?
I don't. I think that will be probably something that the Illinois State Board of Education will make a recommendation based with probably Illinois Department of Public Health. That's kind of what happened this last time. But we just don't know yet. We don't even know what we're looking at yet.
Thank you.
You're welcome. But I do think Illinois State Board of Ed will probably be behind a lot of those decisions.
Any other questions?
Yeah, I've got a question. My name's Chris Miller.
Thank you for recognizing yourself.
My question is, I'm not in the medical field at all, but I have a question on the treatment of using ventilators and as oxygen, the antibiotics, steroids, things of that nature. I had childhood asthma. I've kind of defeated it, I guess. I'm not really too worried about the COVID thing myself, but my question is how can you treat a patient with an infection of their lungs with a closed system such as a ventilator and say that they're not, because it's just continuously pumping, instead of getting fresh air, oxygen, straight oxygen, or even if people are showing symptoms, the whole state lockdown and not being able to go outside and get fresh air, it just seems to me that if someone was infected with something respiratory, being outside having fresh air in the sunlight would be probably the best way to treat it. I just don't kind of understand the whole ventilator thing, because you're seeing reports about people just lung damage and being burned up from these ventilators. It just kind of does, it seems counterproductive to me.
Well, I'm going to have a doctor answer that one for me, but you can go outside. Certainly if you are in any way that you need a ventilator, you wouldn't go outside because you wouldn't live if you weren't on the ventilator. But yeah, I mean, people can go outside definitely and walk and be out in the fresh air as much as possible. But Dr. Vera Weiss, do you want to cover the deal with the ventilator?
Sure, and I'm a retired physician, but this is something I am definitely familiar with, that when people are on ventilators, they are getting extra oxygen as part of the benefit of the ventilator. As a matter of fact, one of the main purposes of being on a ventilator is so that when people's oxygen levels in their system goes low, you can give them enough extra oxygen that it maintains the health of a lot of the different tissues of the brain, of the kidneys, of the heart muscle itself. So you're right to be concerned about your child that has asthma, and the general recommendations are to continue on their usual regimen, so that if they get infected, that they stay, that they don't have more than one thing creating problems, and to make sure that, you know, they're doing all the other things that you talked about. They all sound great too. Getting fresh air, healthy food, healthy activity.
Thank you.
Thank you.
I wanted to add to that question. So is the problem when you contract the coronavirus, is the problem, and then you also have COVID-19 as a result of the coronavirus, is the problem that you're not getting enough oxygen in your lungs, or that the oxygen in your lungs is not going into your bloodstream correctly?
The oxygen in the lungs doesn't go to the bloodstream correctly because of all the inflammation in the lungs, the infection and inflammation in the lungs.
And
So does a ventilator then help oxygen go into your lungs?
Yes, because it makes it so that when you breathe in, or when the ventilator helps you breathe in, there's a higher percentage of oxygen going in. And you can add oxygen by giving somebody a mask that just delivers more oxygen, or nasal oxygen. But with the ventilator, you can add more, and also you can help with the body mechanics of breathing more in, because the person has already gotten really fatigued and they're not breathing as well. And there's more to it than that, but those are some of the basics of it.
Thank you, Dr. Vera Weiss. Any other questions regarding the update to COVID-19? Yes, Kathy. You're muted, Kathy.
You're muted.
I know.
Okay.
There you go.
I'm just wondering what we could do to be helpful.
Well, you are always there. You're always helpful when I can reach out to all of you all the time if I have questions. And like I just pitched that one to Dr. Vera Weiss. So that's good. We've had lots and lots and lots of calls about people wanting to help us contact trace. The reason why we don't have any, we're not bringing in people from that, we needed very specific language skills for that. The other thing is we have to have them in here to do the contact tracing because of the way it is set up with supervisors, so that they can get the answers to the questions. Because rarely can somebody just sit and, you know, do that and get every question answered. A lot of times they have to check back with the case investigator or the people who are in the emergency operations center. So far so good. And I just submitted a budget to Illinois Department of Public Health today. They asked what it was going to cost us to do the contact tracing for another year at the level that we're doing it now. And that'd be about $1.2 million. So I will not be holding my breath to get that money, but that is actually what it's going to cost. Because that is all the staff that is in there doing it. We have about 20 some contact tracers right now working full time on it.
That goes beyond what our fund balance was.
Yeah, but of course, CUPHD is a large fund balance too for a pandemic.
Yeah,
And so, you know, we unfortunately, that's just what happens in a situation like this. So,
that's why we have the
you
fund
know,
balance.
we're going to get the work done, so it will get done.
Thank you, Julie.
Mhm.
Any other questions related to COVID-19?
Could I ask a question about the contact tracing?
Yep.
So currently, I'm assuming how that's working, like what you were saying was people are physically or verbally asking who you've been in contact with, if you can.
Mhm.
Remember all the people you've been within 6 feet for a certain amount of time. But in regards to kind of what Governor Pritzker was talking about today on his announcement and what he's been discussing with the online practices, like what information, I guess, have you guys as the Champaign Public Health Department had in regards to the software and regards to the application that he's talking about developing?
Really not much. You know, we're still doing it old school like we always do, have always done, because contact tracing is something we do every day, and we're still doing it for other diseases. I mean, we're getting reports in every day for, you know, different kinds of things, strep and meningitis, and we've had, you know, STDs and all kinds of things. But with those apps, to me, the cell phones are useful, and we always use these, whether it's a foodborne outbreak or whatever, but we ask people to kind of look back in their own phones to help jog their memory about what they were doing. So that's kind of how we'd use it. I know that I think University of Illinois is developing a specific app for students to help if they come back, to help with, you know, dealing with that. But any app that they come up with would be a voluntary app, and it would be, we just don't know the utility of that for us. We're kind of old school on the contact tracing. I think it's important when someone has, and again, I started my career doing contact tracing for HIV. I just think it's important that you talk to someone when you're telling them that they, you know, have something, so that you can get their questions answered, and that you can then explain to them why it's important to have them refer everybody or tell their friends or whoever they were with, their housemates, to talk to us so that we can get them in for testing as well. So I don't know how the apps will work. Honestly, I'm one of the boomers on the group, so I might not be the one that they would be talking to about it anyway. So that would probably be other staff. But right now we're doing fine with the way we've always done it, which is a lot of telephone calls mostly. We rarely have to go out for it. But that's the next step. If somebody doesn't respond to the phone call, then you make it an effort to go out and try to find them to get them that information.
Yes, Kathy?
Just one more question. And I appreciate, Julie, that, I mean, I know I offered to see if there was anything I could do to help with contact tracing. I appreciate that that's not reasonable. I'm really just trying to figure out if there's a way that we could be helpful. And I'm wondering if, as you guys are doing that contact tracing with everybody, especially since you're having to do so many these days, if you see any other issues arise, like you talked about last time, mental health issues. I'm wondering if there's any other issues that you're finding with these people now that we have a fairly large number of people who have tested positive, if there's anything else that is arising as an issue or a need that we could look at addressing.
No, but we're constantly looking at that, and I will let you know, because I can tell you that the things that have been done in this community are absolutely amazing to me. You know, we have help getting food out to people who are in isolation and quarantine. We have help with deliveries. We get PPE out to long-term care facilities. We have help with that. I mean, internally we have a big group, and then externally we have different agencies and groups, some which have been in our community for a long time, some which just sort of sprang up, and then some which came on board, like Cultivores up in Rantoul, that came on board as the, you know, need arose. So there are just amazing groups. I don't know if I told you this last time, but, you know, one of the things we needed were to get the cloth masks out to people who are working in essential businesses like grocery stores and places like that. I can't think of all the different places, but anyway, the community donated over 3,800 in one day. So that's amazing. And they're still bringing them in. So, you know, we get the stuff out as fast as we can. But so far, so good. But I do appreciate all of your willingness to help with whatever that pops up. And there will be stuff that comes up. I just don't know what it is yet. I mean, I know what this is going to look like when we get to the vaccination stage, if there's a vaccination stage, because we are as ready for that as anybody on the planet, because we practice that to death. But as far as just, you know, we've never had to contact trace and quarantine thousands of people at the same time. We just have never had to do that. So we're in a whole different kind of world. And we're just, it's different, but so far it's going well. And I have to say, again, I have to keep saying this about some of the businesses and the long-term care facilities in our community are doing an amazing job. An amazing job. They really are. And we are in communication with them all the time. And we're going to implement some new regular testing for them now that you don't have to jam the thing clear up into their, you know, do an MP swab. It'll be more palatable for people, I think, if we can do it this way. So they're places are doing a great job, and that's making us, you know, but again, we're part of the whole region, but we're doing, even with all these cases, we're still keeping up.
Well, Julie, thank you for the responsive efforts on the behalf of your team and your staff, in, you know, working so closely with all of these entities to assure that the PPE and the tracing and all of that is being done and accomplished. So we do appreciate that. We appreciate those efforts.
I got two questions here. One was just.
Can you please state who you are? I apologize.
Yep, this is Chris Miller again. I had seen the mass donations online. My question is, the random people in the public were making these masks. What did you guys do to ensure that the virus was not on these masks before they were given out? Was there a quarantine or a cleaning, or how were these things screened?
Yep, good question. So what happened is we picked them all up. We put them all in a room. We had somebody so they came to us in garbage bags, sealed garbage bags. We brought them in. Within the garbage bags, they were in individual sealed Ziploc bags that people donated them. I think they were 20 in a bag or something. I can't remember. But anyway, then we had somebody in PPE who was taking them, I can't remember how many at a time, and washing them. We have our washer and dryer here that we use for our lab coats. And so since we're not using lab coats right now, we were washing masks, taking them out. And another person was taking them out and putting them in smaller bags with instruction sheets on how to wear them, how to wash them, things like that, explaining that they had been washed, and then they were donated out that way.
Okay, thank you very much for that.
You're
the
welcome.
Other question is how, from my understanding and looking at I think it's the website as far as the percentages and how we're on track for phase 3. I got on here late, and I think you guys were trying to cover it right when I got on. The availability of the hospital beds and stuff with the elective surgeries and the things that are going on. How much of a buffer do we have in Champaign County? I'm actually DeWitt County and Champaign County. I kind of live in two different places, but it's the same region.
Yeah.
And Champaign really has a big role in the whole region itself because it is kind of a hotbed, they say, because of all the testing. So it's like, how much of a buffer zone do we have to get going? Because there are people and business owners that need to work that haven't had income since I think March 22nd. Yeah. So the loans aren't coming through, the unemployment's not working out, and these people need to get back to work. And it's just, it's a sad day the whole every day, you know, it's like, what are we doing? And it's all nothing but worry. So then the mental health comes into it. So what kind of buffer do we have?
We are going to move on. We are going to move to phase 3. I can tell you that in the next, what is
11
it?
days.
11. Okay. Yeah, we are going to move. Our region is Champaign County. So the 2 hospitals have a catchment area of about 1.5 or 1.25, I don't remember exactly, million people that utilize the hospital. So you're exactly right. It's not just Champaign-Urbana that is the concern. We have, you know, hospitals here, but it's for the larger places that come into it. Yeah, our region is pretty good because we have a lot of bigger, so we have, you know, Decatur, and that has a couple hospitals, in Springfield, and, you know, all the way across there. So we have a lot of bigger hospitals. The southern region, while it doesn't have that many people, comparatively speaking, it doesn't have very much healthcare capacity either. So our region is doing good. And even with all these cases right now, the hospital capacity and with the elective surgeries, things are still good. So we are going to move into phase 3 in however many days, 11 days.
So what kind of PPE, like, there's not been a lot of clarity on what's going to be required for, you know, tattoo shops, salons, and other small businesses that aren't deemed essential right now. They don't even understand what's required of them to do their jobs every day. So, like, you know, in salons and I've actually, on the WCIA page, I asked this question a couple weeks ago and you answered it, about these people that run salons and tattoo shops. That's a lot of their training is contamination and sanitation and basic health, more so than any cashier has ever been through. And these people are not allowed to do their job every day, but still to this point, 11 days out, they don't know what's going to be required of them to do their job every day.
Right. Well, they do have a training, and I always say that, you know, tattoo artists or body artists can teach the courses in bloodborne pathogens because they have that down. At least in this county, they have that down amazingly well. But respiratory viruses are a whole different issue that they're not used to dealing with, and it's unusual. But so what's happening right now is, so public health is more of an advisory role. It's the city of Champaign that's working, what is it called? The Economic Development Corporation and several others are working together, and they're supposed to be reaching out to the different businesses that are going to open in phase 3. And they're putting together kind of like a one plan for the whole sector. So whether that's salons or body art or massage therapy or restaurants or whatever, or I don't know what, I can't remember what else on there, but all the businesses in phase 3, city of Champaign has taken that on as they're leading that right now. So they're working with all the other places in the county to do that, so that our county has like one plan, and then there could be little, you know, variances off of that.
Is that going to be posted on a website somewhere so that people that don't get contacted, they can go to a website to look at what the basic requirements are going to be?
Yeah, I don't exactly know where they're going to put that, but I hope that they're going to be sending it out to places as well. You know, we work a lot with restaurants, obviously, because we did before this. So that's one that that we'll have more guidance on that when they're ready to open. But the focus right now is on the things that are going to start opening right away in phase 3.
Julie?
Thank you.
I think we're not focusing on the real aspect of what's actually being done. Sunsinger is an essential business. We've been operating and reduced our business down to food service carryout. We also have a deli. You can walk in the store, have deli. We have a liquor store. We're like a grocery store.
Yeah.
Packaged food and things like that. Prior to this lockdown or close down isolation order that came out by the governor on was it the 14th of March, about the 9th of March, we started, my manager and I think Rick's on here too. We sat down and discussed how we proceed with keeping our customers safe as well as our employees. And so we sat down and developed a list based on CDC recommendations for cleanliness standards, cleaning every 2 hours, the various things of establishing tests and keeping records of paperwork and of these tests and of the cleanliness issues and the cleaning schedule. And ultimately on the 17th, we had to close down because there just wasn't enough business to keep going. And the situation was dire at that point. Since then, we reopened on the 28th of the month of April after being closed for 7 weeks. And we've been very proactive from the get-go in doing this. I was able to get PPP funds, which are halfway through and are nearly running out. I received my EIDL funding yesterday, and so I'm in a position to continue business, but we have to have some direction. It is imperative that the public health, that the governor's office recognize the dire straits that all of us restaurateurs are in. And it is a situation that is dire. If we don't get opened and having seating service business by June 1st or June 15th at the latest, all of this PPP funding and everything's going to be for naught. It'll be wasted. And so we won't be able to continue. And so it's imperative that we do get some direction. And like I said, we have direction that would work for most businesses in this community right now that I'd be happy to share with you all. And we think that we're doing things in the right way.
It would really be best if you would share that with Bruce Knight at the City of Champaign, because they're the ones that are working on putting those plans together.
Okay. But I want, the main thing I want to emphasize is the critical nature of this, and we're 11 days from going into phase 3. When will restaurants be allowed to have 50% inside seating or 40% inside seating with the proper public distancing?
Well, that's a good question, and we are absolutely having discussions with that, because we know that there are some places, like you said, there are some places that would do this perfectly. And so there are some places that are open now doing it that are not doing it perfectly. So, it's all over the place, but we know that there are places that could do things safely. And we are looking at trying to get some sort of a timeline on when that could be. Because, whereas just a bunch of people sitting in a bar is a whole different thing than to be able to have the restaurants with the seating open. So I know that we are actually advocating for that, because we know.
I'm glad to hear that. As we go forth, though, the governor seems to be hung up on the issues of hospital space, and I think there's 3 cases in Carl Hospital now. It's not like it's overrun. I don't know how many rooms are in Carl Hospital, but it's an amazing amount of rooms that they have over there.
Right. No, we're good. That's why I know for sure we're moving into phase 3. What's still getting hashed out is what exactly is going to go into phase 3. We know some of the things, we don't know all of them, but we are advocating for certain, restaurants, certain kinds of places to be able to be open, because we think that they'll be able to do, a good job with it. It will be reduced seating, and there will be some differences, obviously, but
there's a possibility then, just to based on the phases, that some of the criteria in phase 4 could be instituted with phase 3?
Well, I don't,
Percent restaurant capacity is currently in the phase 4
yeah.
5-phase plan.
Yeah, but there are a lot of variants being brought up and addressed. So I think that it's still possible.
Is there any accommodation for tailoring these guidelines based on places that are choice visits compared to places that are necessity visits? I understand everyone in our community needs to go to the drugstore and the hospital and the grocery store. And while not everyone has to go to Sunsinger, some people like myself choose to go there. And these one-size-fits-all and blanket rules are killing small business. They're killing morale. And I'm not making light of the situation, but in a county of 209,000 people, 333 cases, which half of them are cured, and probably 33% are at Rantoul Products. I'm not on board with the one-size-fits-all rule. Is there any consideration for accommodations for those kind of businesses?
That is something that we're looking at. That's what I'm talking about, that we're looking into. Is anything that was in phase 4 could be done differently in phase 3? So yes, I mean, that's.
And do you have the right to do that under the governor's blanket statement that
not
his rules?
No, not countywide, region-wide. I'm
Yeah,
sorry,
so
I misunderstood you.
Yeah, and that was
Sorry.
Brad Pasalacqua, Amy. And just to let you know, also, Julie Kumar joined us about 10 minutes ago, Amy. Thank you.
I've got 2 questions, and they're really related to Brad's. So you were saying you're looking at things that are in phase 4 that could be applied to phase 3. So, and then you're going to make the recommendation up the chain of command, or who would make that decision that there are some things in phase 3 that, we could just do in phase 4 that we can now apply to phase 3 regionally, collectively as county health departments? We're going to apply that, or we're going to just say, hey, Governor Pritzker, we think we could do this, and he's just going to say, oh, okay, go ahead? Or
yeah,
I'm confused on who's gonna dictate the state's plan to now adapt a regional plan.
Well, it's because what we're talking about is something coming over from phase 4 done differently. So it's not just like, opening everything up widely, but like having, like Michelle had said, having, limited seating type of stuff. I don't know exactly what that would be, but there's all kinds of things that places are looking at, certainly not just Champaign, but it's not only the health departments, obviously, that are making these recommendations up there. It's also lots and lots of other groups that meet with the governor as well.
But it would be, so here Champaign County Health Department sees like, okay, this type of business that's in phase 4 could be applied to phase 3, so we're going to recommend that. Or it's like, hey, we see that this group in phase 4 that's supposed to be open in phase 4 could absolutely open in phase 3 right now, so let's let them open. Who gets to make that decision, I guess, essentially, is my question.
No, that would be the state. We're still operating under the executive order.
So then how can we say that we're going to look at that?
Well, because we already are looking at it, and we're making the recommendation.
Okay.
Yeah, we are.
And my second question was, so you said in 11 days we're going to move to phase 3. We're in the numbers look good. Mm-hmm. If between, is there then after that, is there a certain amount of days, like Governor Pritzker said, through May, we're in phase 2, everybody's in phase 2, no matter what. Is there a time limit after we move into phase 3, or is it based all on statistics when it comes to numbers? Could we move into phase 3 within 7 days or 10 days?
No, okay, so the reason why, that's a good question. The reason why it has like a time period now is because it's having to do with the 28 days. So when they introduce the plan, so it's moving the 28 days, but could one region go faster into stage 4? Yes, absolutely. And it all has to do, with what's going on in the whole region. And yes, that could happen because after that, it'll still have to be at least a month. But yeah, that could do it. But the other thing you have to remember is if it gets bad, it can go right back.
So we're going to move into phase 3. It has to be at least a month. It can't go any faster than that.
Probably not because I have to look.
It's 28 days.
Yeah, I think it's 28 days is usually what it is. That's 2 incubation periods. So that's where the 28 days comes from.
And then after that, who makes the decision? Is it the state or would it be local decision? Like, hey, our statistics say we're good and we've done it for 28 days. So we're moving on. Or is the state going to say, hang on a second?
It's all based on the data. So if we say we're here and we're ready to move on, then they will say move on.
But if they don't say move on, then we cannot, correct?
Well, if we just like randomly, if tomorrow I just decided we were going to jump into phase 4 and skip 3, that would be different. But yes,
no, I mean,
the
if
data
the data
is going to, yeah, it's all based on the numbers that you see on that dashboard. So yeah, if we're ready to move into that stage, we'll be ready because the numbers will be there and we'll get to move into that.
And then one more thing, you said that there was a difference between restaurants and people hanging out of the bar. What is the difference?
The difference is that if you look at the bars, they're completely crowded. Every place that's tried to do the bars, and that's pretty much what it is. It has to do with how you can control the distancing.
So is that left up to the health departments and someone to decide that a bar cannot limit their capacity? Like, what if they wanted to say, we'll let 25% people in?
Yeah, no, that could be done. If I can't just randomly say I'll do that, but I mean, if we get into stage 4 and it'll say you can open bars with X amount of capacity, then yeah, that can happen.
Thank you. Julie, did you have a question? I saw your hand go up. Julie Kumar.
No, I think that was an itch.
Oh, okay. Just wanted to.
Thank you, though.
This is Chris again. I have a question that I think it absolutely has something to do with the phase 3, phase 4 issues. And Pritzker talked about it today, and he kind of beat around the bush. And I think it's going to be a rather large issue, and that's going to be childcare. Because phase 3 is coming, people are going to go back to work, and there's not emergency daycares open. And that has to do with, I believe, the health department directly with DCFS and all those things, right?
The state health department, not the local health department.
Okay, so we're going to have parents that are going to go back to work, but don't have daycare. So now what is going to be in place for this? And you're going to go right back into an issue of people watching kids that aren't licensed and issues coming about because daycares are in phase 4.
Yeah,
so
I
what's
think
the press here?
In general, daycares are, but see what happens is, and this is that once the workers, once the next set, that's going to be, essential workers, if you will, the next people that are working. So my guess is that they're going to expand the daycare again, open up more. But we don't license the daycares, that's the state, but I think that they're going to go back to more daycare. They're going to have to.
He said that he was trying to apply. There was like 2,600 emergency daycares for the whole state of Illinois. And you'd have to think that an overwhelming majority of that is north of I-80 because of the population. So there's licensing and different things that people are supposed to apply for, but again, no direction, no anything, no directive on what's supposed to happen. So I was just kind of curious on that, you know, because that's what you're going to see, people that don't have daycare now because they have to go back to work. And I don't know, it's going to be an issue.
Yeah, they're not going to have a choice. They're going to have to open daycares. You cannot have daycares closed and expect people to go back to work. It just.
Brad, I see you have your hand up.
Just for a point of clarification, I'm not sure I heard the answer to one of Cody's first questions. And I think what he was asking, Ms. Pride, do you have the authority to move us ahead or backwards, irrespective of JB?
No, it's all data driven and it's their whole region. It's not based on the county. I do not.
So some of our ideas may be for naught then, correct?
Well, yeah, I mean, we can make the recommendations, but yeah.
Well, how are your recommendations often heard? I mean, are your recommendations taken seriously? Are they even heard?
They are.
Sorry.
We actually, so I am on a group that talks directly to Dr. Ezike, and we're asked a lot of times how we think something would work and how something's working in our specific county. Of course, there's a ton of counties, and everybody puts in their information on how things are going in their county. And then we try to brainstorm through some of the issues because, you know, we all want things open too. We don't want businesses suffering. We don't want people suffering. That's not what we're about.
Okay.
But it does actually, I know for a fact that it goes from Dr. Ezike to the governor.
So just one more question while I have the floor. Are the gymnasiums in the hotels open at this time?
They are, as far as I know, they are supposed to be allowed to be open only for somebody that's staying at the hotel.
Of course, but they are open.
Well, I don't know that they are, but they are allowed to be. Only for, they can't bring anybody from the outside, and it can only be hotel guests, which of course there aren't that many hotel guests probably right now, but.
Okay.
Yeah.
Is that, hold on, Brad, is that just a little bit hypocritical that we just served a cease and desist on a gym and we are letting hotels have their gyms open when our wonderful governor owns a major chain of hotels? Does anybody else see the hypocrisy in that?
Surely.
David, you had a comment.
Well, just on the question of what control or what influence we can exert if to change us from one stage to another. I mean, what the governor's established is in fact fact-driven. It's data-driven. Right. And so if you know, you can argue, reasonable people can disagree on what facts are. We've seen that in spades in the last couple of months. But if we thought that the facts showed that we should be at a different stage, there would be. The legal system is there. Mm-hmm. I mean, you could argue that. I would take that case, you know, and so it's not that we don't have influence. It's that, but if somebody's arbitrarily telling us we can't open when we really can, when the facts show that we can, the legal system's going to be there for that.
Yeah, and I don't look for that to happen because you know, we want to get stuff going. But we also don't want to go back to where everything has to be shut down again to keep the hospitals from collapsing.
Julie,
Michelle,
you know, looking at a map today.
Who's speaking?
Michelle.
I'm sorry. I was
Michelle Yarbrough.
I was looking down at the bottom. Sorry.
Looking at the map of the entire country today, there's only 2 states, Illinois and Michigan, that are still locked down totally and haven't allowed any reopenings. And
it's Connecticut and Massachusetts, I think. Not Illinois and Michigan. Illinois and Michigan are in the process of opening up.
Well, the map that I saw listed Illinois and Michigan. So, but still, it's because the city of Chicago and the city of Detroit that affects the entire state. And there's such small segments of the entire state that there has to be some reasonable guidance taken by by government authorities, if not the governor, then the legislature, to override some of these things and allow us to get open and to save our jobs and to preserve my business and other businesses.
Mm-hmm.
Thank you, Michelle, for your comments. Did anyone else have another question for Julie? Okay. I appreciate the lively discussion. I appreciate everyone's passion, and I hope that everyone has now had an opportunity to speak, and I hope I didn't miss anybody and that we recognized everyone that was in attendance this evening, and that we were able to hear and voice to your comments and your concerns.
Yeah, and can the doctors look at me and tell me if I look like I'm having a stroke? My right eye is drooping for some bizarre reason. I hope I'm not
Probably
having
all that CO2 from your mask.
It is. It's because I had coffee before I came on here. I'm about to gag myself.
I will make a parting comment as well. I appreciate you having this forum, and much like voter turnout, I'm very disappointed that there isn't 1 million people on our screen.
I agree with that.
Like Mr. Goss has something to say. You know, my disappointment is really in the state of Illinois, maybe more so in the county, but as a county, with no respect to party, there has to be more of a group effort to separate ourselves from north of I-80. And I'm not making light of the disease and the fact that it's contagious, and that there are a certain sector of the population that needs to be protected more than others. But I find myself being very fortunate to be in essential business. If I wasn't, I don't know where I'd be right now. And I'm trying to support all of the small businesses that I can. But as a community, as a county, we have got to not necessarily make our own rules, but we have to be heard, and we have to be heard in how different we are from Chicago.
Okay, I do want to point, I do need to talk about this whole thing with it being Chicago, because that just isn't the truth. Chicago is its own issue, but they have a ton more people than us, but you have to remember that they also have a way more healthcare capacity than us. We, as far as I'm concerned, we're in kind of the sweet spot in the center of the state for what the reasons why I said. We have, you know, we have some big hospital systems throughout here, and we have some areas that are not really densely populated. But the southern region, you know, that's why we are in regions, because each region is able to move independently of the other one. What happens is when these counties are doing their own thing, that could pull the entire region down, or it could, you know, hurt the whole region. The southern region, they're very sparsely populated, so you're not going to see as many cases, but the problem down there is they just don't have hospital or healthcare capacity. It's very, very sparse in a lot of those places. So they could really get into a problem. You know, they get in an outbreak and out down there, and it could be seriously bad.
Julie, may I make one more comment, please? It's apparent from a Channel 3 news article from a couple of days ago related to the misreporting of COVID deaths that are charged to COVID-19, where they're irresponsibly done, where there have been no tests performed, where a heart attack or some other underlying illness has caused failure, and they've got testimony of people saying that we assigned these people to COVID-19 because that's what they wanted us to do. This misreporting has skewed the entire system to where it allowed Governor Pritzker to move his target date from May 1st to June 1st. And that's the only data that he used doing that, is in my opinion. And so somebody has to have a common sense approach to why they're doing this. And I suppose that from what I understand, that every COVID-19 death received $109,000 from the federal government for support causes. And is there truth to that?
I have never heard that. I can tell you that there is a ton of stuff that's going around that is not true. But I can't tell you, you know, I try not to get involved in all that. I try to just stick with the, stick
I
with our
understand,
county.
but in your respect of trying to do the right thing.
I know our 7 deaths. I mean, that's all I really know is ours and our county.
Right. I understand that. And
there's no money that comes for a death. I don't know where that comes from.
well, apparently the state or somebody's getting paid off by all these things in New York and in Illinois for sure.
But who would be paying them?
I guess it's federal government. I don't know.
Yeah, I can't imagine that, but who knows? But I've never heard of that.
Well, that's what I saw on a report done here on local news on Channel 3 recently.
Okay.
Thank you.
I had one more question. This is Cody.
Mr. Moody, is that you? I'm sorry.
Yes, Mr. Moody. So in regards to the governor's, I guess I had 2 questions. In regards to the governor's statements today and kind of yesterday, the news was publishing that he was trying to make breaking the executive order a misdemeanor. Is that now a part of his his executive order, or is that going through legislation? Do you have any insight?
I was too busy today to even look at that. I didn't watch it. I will have to see what comes down in writing about that.
Well, it was something about breaking the local public health departments.
Mhm.
Like if a business opened illegally, essentially under the executive order,
Mhm.
that they were trying to make it a Class A misdemeanor. And I didn't know if that was just going into effect under his executive order, or if, and I know that the legislature is going to reconvene this week. Is that correct?
Yes, that's right.
So I didn't know if it was a bill that was trying to be passed, or if it was just a part of, because he said something about a rule change.
Yeah, I'm sorry. I don't know. I'm sorry.
And then my second question was, you were saying like that we can't say that Chicago is completely different, but you were saying, and I looked it up as you were talking too, we've had 7 deaths, and I don't know how many confirmed cases in Champaign County, but how is that not different?
No, I said
It's a regional approach. The order is
sorry, I said that it is different. We are different. That's why we have the regional,
right.
We have regions. No, that's why I'm saying that that Chicago is completely different than us, but that it's not what I'm trying to say is the whole state's policy is not based on Chicago numbers. They put it into regions because that makes more sense. What I am concentrated on is not even our region. What I focus on, and my world is literally about this big right now because all I focus on is Champaign County. That's all I can focus on.
Mm-hmm.
Thank you.
Thank you.
Thank you. Mr. Goss, you had your hand up.
Yeah, thank you. I wanted to wait till the end just because my comments are kind of all over the board, more particular to the County Board of Health. I really wanted to voice a little bit of disappointment with our Board of Health on a couple of different issues. It's disappointing that it appears now and I've heard it confirmed this evening that there's been no discussion or guidance for our businesses that are out in the county so they can start to be prepared to reopen and reopen safely. I know that the economic engine's not going to start turning here, and unless we're ready to go when the day, as Michelle said, I mean, we need to be ready to go day one. So May 30th. And I think that the County Board of Health should be leading that discussion for those out in the county. It's disappointing that we haven't. And the other thing is, it's a question that I posed at the county board meeting. It seems incredible to me that things started happening in Rantoul once we had 2 state reps and a state senator get involved. All of a sudden, testing started to happen at a rapid rate. And my disappointment was you know, we had this cry for $470,000 that we were going to need, and we are going to need it immediately. And then tonight I hear that we haven't really needed that, which is great. Don't get me wrong. There could be a point when we need that money, but to sit here and talk to the county board that you had to have that 470,000, and there's just no way that you could get by without it. I mean, here we are nearly 30 days later, and thankfully we haven't had to touch it. But those are a couple disappointing things from a county board perspective, in that fact that we've got a county board of health that's failed to lead us in a couple of critical items here.
Okay,
I think that's disappointing.
I can comment on both of those. The stuff that for the businesses to reopen is going on. It's not being led by public health. That's not our role. Everybody has a role in the pandemic. We have a plan. We've had plans. And the people that are supposed to be doing that, which is the business community, are working on that. That is not for us to be working on. We're doing what we're doing. At the point in the pandemic, and to say that nothing was going on at Rantoul Foods before a legislator got involved is about laughable and completely untrue. So we worked with Rantoul Foods for a month trying to get them to implement the standards, the basic infection control standards that they had received from the CDC, from public health at the state level, from Champaign-Urbana Public Health District, and also from their various, USDA and OSHA and other places. None of that stuff was implemented. We worked and worked to try to get them to do that. They fought us. So once they had a case there, then we were able to go up. We had 2 cases, and we went up and we shut them down. Once we shut them down, magically, they were able to get the PPE pulled out of an office, and boom, they were able to implement all the infection control practices that we had been asking them to do for a month. So we did testing. We were up there the next day with the Carl Mobile Clinic and my staff running logistics and doing the in the shop, or whatever you want to call it, in the plant infection control review. And that's when we noticed that not one thing had been done yet. So we shut them down. Then magically it popped open again because they got everything done that they needed to. By that point, not only was everyone surrounding, almost everyone we tested, what we did was we tested the close contacts. That's our protocol. We did that. Every single other person in that entire plant, all 700 of them, were given codes. We did it in French, we did it in Spanish, we did it in English, and we did it in Conoval, so that everyone there would be able to go out and go to the testing sites and get the free testing immediately. What we found out during these ensuing days working with the plant was they were not getting them to go down there. I kept getting comments, how can we make them, go do testing? I said, well, the ideal thing would be to do is to, number one, mandate it for them because you're their employer. And number two, give them either an incentive or time off work to go do that. Give them an hour off in the morning, give them an hour off in the afternoon, something. So to say that nothing was done is completely ridiculous. So what happened was OSF and SafeWorks, who SafeWorks is in there all the time, we were working with them to try to get infection control going too. So the fact is, this gigantic outbreak that we have that's centered at the pork plant, and for them to say they had no idea that they could possibly have one, then they must not have a television set and they must not have a newspaper, because all of these meat manufacturing places all over the entire United States are having the exact same problem because they're doing the exact same thing. They're waiting until they have an outbreak rather than doing any prevention. Prevention is always cheaper than outbreak. This outbreak is going to cost a ton. So when the money from the county starts coming and we start putting it on staff, once we finally get to start billing it, that's where you're going to see it eaten up, is because for every case, there is a tremendous amount of work that has to go on with that. That's all being done. That's 7 days a week. That's contacting them, their families, and the other people that they infected. And if I were to draw this out, this one outbreak has spread not only to our county, to multiple counties, to multiple towns, not just Rantoul. certainly a ton in Champaign-Urbana. And it is the community-based organizations and the groups that we work with, that we've had relationships with forever, that are picking up all the slack for this. So that's the reality of it.
I'll say also, Jim, that I agree with you that this is an appropriate forum for us to be talking about the public health aspects of reopening. I think this is this is kind of a continuation of public participation, and I think that's a good thing. And so Julie's right. I think that ultimately it's not our responsibility. It's the other governmental officials that will be working on that. But I think it's very appropriate. I think you're right that we should be talking about it. I do want to point out on your other question, though, that I don't know what you were being told, but I listened to Julie's presentation at the county board, and I think it was made very clear that no one was saying that money was needed. What was being said was that the money was in our fund balance, a fund balance that had been allowed to grow because of the possibility of a pandemic someday. And we wanted to make it available to you in the fund balance so that if needed, it could be used. No one was saying that anybody needed to spend that money, as you're insinuating.
No, in fact, I said we had nothing, absolutely nothing to spend it on.
Really said we weren't going to spend it, actually. It was to make it so that there wouldn't be a time lag. If the emergency really happened, and I mean like in the matter of days and hours, then you'd have it available to you. And it's the county's money. And so it's not really fair to say that we were giving you the impression that it was going to be needed immediately, and now 30 days later, when it hasn't been spent, there was something fraudulent being done by this board. I mean, that's exactly what we told you, was that it wasn't going to be used, and we hoped it never would be used. We were making it available to you.
Let me clarify. I never said fraudulent at all. So
no, that was my word. That was my word, Jim. But that's what you were insinuating, was that we led you to believe something, and then it turned out that what we led you to believe didn't happen. Quite the contrary. We told you exactly what has happened, and it's great. It's good news.
Yeah. And we just got a $60,000 grant that came in today for the county. I told you all I was applying for it. So how this works is that we have the bucket of money, the regular money that we have, and then we have the fund balance sitting in there somewhere. It's on the bottom of the bucket. As I get more grants, that money will go on top of that, so that the fund balance is always going to be the money of last resort. That's just how we work. It'll be the money of last resort, but it has to be there in case we need it at some point.
And the other thing that I would add to is, Jim, is that we've added a lot of additional meetings over the last several months to be open and responsive to the public and to the concerns, and keeping the communication open with the county board as we're all dealing, with this pandemic. And at this point, we don't know what is going to be the next state of the orders, as Julie has been explaining all evening, in terms of when businesses will be allowed to open. But, certainly very hopeful that based on the metrics that will be very soon, because that certainly is something that we want to see happen, and that we want to, make sure that those individuals in the community are getting the assistance that they need. But at this point, that we don't have that directive from the state on that. But I'm happy to see the public participation for all of the previous meetings. We have not had public participation when we've opened up since the COVID-19 pandemic began. So we are trying to be very responsive, and I would certainly encourage anyone that has any questions or concerns to continually contact, through Julie's office or through the Board of Health, that, we want to be that sounding board for you, and we want to make sure that people are getting the information they need in a very timely manner.
Yes, and I answer, we answer questions, hundreds of questions a day. We answer every question that comes in as best we can, or we try to refer it, and that will continue as long as we can.
Hello, Cody Moody again. Two last things from me. Will there be another one of these types of meetings? You were saying you were thankful for the community feedback or participation today. So
sure.
That's my first question. Go ahead and answer that.
The next one is scheduled for June 16th, but at the end of this meeting, as we close, I was going to ask the board if they would like to meet again prior to June 16th. So that is a question that's coming. I haven't addressed that yet though.
And then how does the public access that information? Because today I was sent an invite through Facebook. I would have never have known about this other than some individual sending me the Zoom link through a Facebook meeting.
It's posted. Julie, did you want to respond to that?
Where is it posted? It's sent out to the media, so the media gets it for at least 48 hours ahead of time. It's posted on with the county, the county's website, the county board's website as well.
The Zoom link will be posted there on the county website?
Yes.
Okay.
Yes.
And then my second question, I guess, was in adding to Jim's comment or point. I'm trying to clarify his point, I guess. He was saying he was disappointed in the Champaign County Health Departments or the boards leading the way in small businesses reopening. And you were saying, you know, it's a bunch of different mechanisms, right? Working together. But wouldn't it start with the board or with the director giving advice for proper?
Yes. We've already.
And I just asked that because my wife works in Ford County. When this all started, she was not being allowed to work from home, even though she was an essential business, but she could work from home. They worked for a telecommunications company. It's like, you're the number one person that could work from home. And I called them and I asked them, how are you communicating to the health or to the essential businesses your best practices? So I guess my question, adding to Jim's, is how are you communicating? Because, and I think I agree with him that it should start with the health department. Not that there's been a lack of it. I don't know. I haven't been following it that much, but I think it should start with the health department leading the way, giving best practices for small businesses to be prepared to really attack it on day one.
Okay, look, this data or this information, these plans, it's kind of a generic thing. It tells you what things you have to do. We're not going to go into every business and tell them how to do their plan. We couldn't possibly do that. What it is, it's the same. The guidance is on our website. It's on the IDPH website. It's on the CDC website. It talks about how restaurants, how different places, salons, different places like that should open, you know, or not should open, but how they can do infection control. A lot of the guidance we had out was at the very beginning of this. We put out a ton of guidance for places before the shutdown because we were trying to prevent outbreaks even before the shutdown happened. We were trying to prevent outbreaks locally. So the health department has led that in the sense that the guidance is out there. We show them this is the guidance, the business community. And again, we're working through the City of Champaign's business department and whatever it's called, Economic Development Corp. And they are supposed to be working with the sectors and doing this. This is not what we're doing right now. What our main job is right now is to deal with the cases and the outbreaks and the contact tracing, and to make sure that we don't do something to cause us to slip backwards. So the business community has to move forward. The guidance is out there.
So the information is out there.
Yes, it's out there. It's from CDC. There's not a lot that's really different. It's from the CDC, says basically the same thing IDPH is saying and what we're saying. Ours may look a little prettier, but it's the same advice. It's the same stuff. But what the city is supposed to be doing, and it's a county-wide thing. It's not just us. I know Scott Eisenhower, for example, is involved in it. And they are going to work in sectors. And the reason why that is because these are like-minded persons. I don't know how a salon operates. I don't even know how a restaurant operates. So they talk to each other, and then they can use the guidance and then come up with their own individual plans. And that's what it's going to be. This is not going to be like a plan review for starting a new restaurant, for example.
Julie, so we developed our guidance that we used since the 10th day of March from CDC, from your guidance and so on. We have a plan. We have put it forth. I was told just yesterday by my accountant that works for another restaurateur that the city of Champaign was contacted and they didn't have any advice for this other restaurateur. And so who should I talk to at the city of Champaign specifically to pursue this?
Bruce Knight.
Okay.
He's
That's
the one
fine.
that's like the lead person on it.
Okay, that's good to know.
I got something. This is Chris again. To add to that, if the guidelines were put out for essential businesses, if a non-essential business can maintain 6-foot social distancing, can wear masks, because I'm an essential employee myself. Okay, so I go to work, I drive around in a truck. When I have another person with me, I have to wear a mask. We both have to be masks. But as a non-essential business, if they can maintain social distancing, they can wear a mask, they can wear gloves, they can sanitize, they can limit the amount of people that are in their building. Why can't they operate if they can do all these things for the last month?
Executive
And
order.
now,
Executive
yeah, that's what I'm saying.
order,
Like,
and
why?
they're moving
If
into phase 3 and then they can, but
if a business is able to do that in Champaign County, would you shut them down, cease and desist, if
Yeah.
they were meeting all those requirements?
yes. Until the end of the month when they move into phase 3, yes.
So do I understand then, Julie, that once we move into phase 3, that at the beginning of the month, that we can pursue our opening situation and maintaining these standards?
No, not unless that is part of the executive order.
Dr. Vera Weiss, you had a question?
I actually wanted to explain another piece of what's going on, which is that the people in leadership roles in Champaign County had set up a whole system to deal with a health emergency like a pandemic, and that is being run out. Julie's referred to the I'm losing my words on this. The cooperative process is happening involving the law enforcement, community groups, and Julie's one of the co-leaders of a lot of this, and the sheriff is leading another part of the incident command system, the emergency operations center, and different tasks to get it all done are being performed by different groups. There's the healthcare group, public health group,
faith-based
parts, and the business planning part, it sounds like the city of Champaign is responsible for that. And so even though they all talk to each other and make plans together, in order to get everything done effectively, it is separated out into the different groups.
Correct. And obviously we have our own role, which is what I've already talked about. But yes, there's a hospital sector, the healthcare sector, the faith-based sector. There's all different types of sectors that are working together on these things.
Thank you. Any other questions or comments?
I'm just going to make one last comment.
Yes, Bradley.
Last week at Committee of Whole, I sat and listened to Annie Murray, owner of Pear Tree Estates, pour her heart out over not having her business be able to be operated right now. I know those girls. I went to school in Fisher. I went to school with those two girls that own that business. And to hear her pour her heart out about not being able to do their weddings and have their business, that's why I'm so passionate about getting this county open back up. We've got to.
Yeah.
These people, she
Brad,
doesn't employ a lot of people.
Right.
But
I'm not unsympathetic to that. Trust me. But again, you listen to that story. I don't like to hear people, I don't like to see anybody hurting for any reason. That's not my thing. But, I also am seeing the horrors of what we're having going on with these outbreaks, and the people, just because somebody isn't dead doesn't mean that they're not being hospitalized for a long time and that their families aren't suffering, because when you go into the hospital with COVID, you go in there alone. And it doesn't matter if you're an adult or a teenager or whatever, you're going in there alone and you're going to be on that ventilator alone. So there's a lot of horror stories all the time going on. I know that. But you have to understand that we, public health, we are not the enemy. We are not the enemy in this. And I don't know how else to say it. We are trying to do what
I'm trying to indicate that you were the enemy. I'm just trying to.
we're trying to do, but you can't just keep saying we have to open it up, we have to open it up, we have to open it up. We're going by the plan that was set forth, and we're doing that. We're not going to go, I'm not going to just go, rogue and just say, oh, screw it, let's just, do whatever, because that's just not how it works.
But even if the plan is wrong, you're going to go with it.
I'm not saying that the plan is wrong. I don't think that the plan is wrong, Bradley. And certainly people at the hospital do not think the plan is wrong, because we see the bigger picture of it. It is horrible that people are suffering for not having jobs, or their businesses are suffering as well. But again, our main job, our purpose in this pandemic response is, number one, to save human life. That's number one. Everything else, whether you like it or not, is secondary to that. And I can't, if people don't understand that, I can't make them understand it. But that's what it is. That's just how simple it is.
Julie, not to speak for Brad.
What?
I'm sorry, who's speaking?
Cody Moody, not to speak for Brad, but I think Brad was not saying that we're not worried about that and that we're disregarding that. I think that Brad is imploring simply that, yes, we understand COVID is very dangerous and it's costing people their lives. I didn't start this conversation off. My father has diabetes. I'm extremely worried about him for that case. But at the same time, I think Brad is talking about there are other people, or there are other lives at risk due to the
livelihoods.
Correct. But
Okay,
again,
that's what I'm trying to say.
So I think Brad's just saying
it's a balance, and I don't make the
we can't
whole
just focus one simple protection plan. We got to think about. You were talking earlier about balance, and I would say the majority of the public here does not see a balance.
There is no balance.
Well, again, I can't do anything about that. I am following the guidance. I believe that the guidance is sound. It is absolutely, like it or not, it's based on reality, it's based on data, and the hospitals and the healthcare system are 100% behind it as well. Public health across the board is focused on the same thing, and it is certainly not to ruin people's businesses. But if we do stuff too fast, and I don't know why people can't get this through their heads, if things happen too fast and we start seeing those numbers go up, everything is going to have to shut down. Because
my question is on the numbers going up.
Sorry.
This is Chris.
Okay.
This is Chris. It is proven in other states and other communities that there's not these mass outbreaks that are happening that people are scared of.
It's not proven. It's absolutely not proven. How these work, it takes at least 2 weeks to see the results of anything opening. We saw over, Mother's Day, we see a spike. We see, Easter, we saw a spike. So we see how this stuff works. So no, that is not true. And again, if we end up doing it in the wrong way, then it's going to have to, it's not, everybody likes to blame the governor or the president or whomever, but the fact of the matter is the virus is what dictates what is happening, period. And how we get where we are with if we can get a vaccine, we hope to God. We don't even know yet if you are infected, if you have immunity. That's an important piece in this that we don't even know yet, because this virus has only been on this earth 5 months or so. We don't know this stuff.
Cody,
the case spikes. The case spikes, right? Illinois is doing more testing than any other state.
Correct.
And my question is, yeah, we're seeing these spikes in cases, right? But are we seeing spikes in hospitalizations compared to other states that they're not running tests? People are just living their life, going about their business just like they would a common flu or cold, that we have vaccines for that. And it's proven that there are more deaths right now from those things and pneumonia and everything else that
No, there isn't. We're not going there. I'm not gonna argue BS science with you. We're not going there. There is reality, there is facts, and then there's opinion. I'm not gonna go there. We try like hell to focus on the facts and to be as fair as we can. I am not gonna go and start talking about stuff that is simply not true. This virus, look at the numbers of Americans that have been killed by this virus in 3 months. It is mind-boggling. And even if you want to believe that there's some magical thing happening where people are making up deaths for it, look at the numbers. This is unheard of. And just because it's not affecting individuals personally, doesn't mean it's not happening.
Okay. To that point, can I add a
massive? And this winter, we all had better hope to God that this does not turn into what it absolutely is predicted to turn into this winter.
Two things, and then I'll be done. One, thank you, Cody, for trying to help me get my point out. I got interrupted, got sidetracked. Thank you very much, sir. Number two, it wasn't that long ago on one of Governor Pritzker's press conferences, the director of IDPH stated that how they were counting deaths, or if you were in a car accident, it didn't matter. You died and you had COVID in your system, that was a COVID death. She said it right on national TV.
Okay, Bradley,
I mishear it.
This number, trust me on this, and pick up a book and look at any other past pandemic and you will see, or any outbreak, the numbers are way undercounted to begin with. They're always way, way undercounted. So once they get the data straightened up, you know, what you're concerned about, what she said, which was wildly misinterpreted by a lot of people, but it doesn't matter. If there are some cases one way or the other, it's irrelevant. This is nothing like the flu. This is nothing like a cold. This is something that you will be seeing the results of coming this winter if we don't get some sort of vaccine or prophylaxis or great treatment. And that's just a reality.
My question was to you, Julie. She did say that, correct?
Yes, I know what you're talking about. Yes.
Okay, thank you. That was it. I just had that question. Thank you.
Okay, thank you, Bradley.
Julie, may I ask one more question?
Yes, of course.
We had a public health inspection on Thursday, which we discussed earlier. I won't reiterate that, but we were told that there was a number that any essential staff member could go to one of the drive-ups testing facilities and be tested. She said that those tests are being done with the long stick method of going clear back into your sinuses. And earlier, I believe I heard you say that the shorter term method tests are available.
Yeah, you can go to those as well as of tomorrow. That was what I announced earlier. So starting tomorrow, anyone who's working, or anyone with symptoms, or anyone with an underlying health condition. So that's basically just about everyone can go to the one at the mall. It's run by IEMA and the National Guard. It will be a self-collected swab. They're going to give you the little swab, but you will just go around inside of your nostril, not, up to your brain, but You'll just do that. And yes, starting tomorrow at 8 a.m. to 4 p.m. every day up to, we're not sure if it's 500 tests a day or 750 tests a day. Everyone's eligible for those. And then it'll keep going, and it's going to be 7 days a week. So we will start getting a really good picture where the testing in our county has ramped up, and it has ramped up for one reason. That's because the University of Illinois is making the reagent and making the stuff that we need And they have worked with and taken all their machines to Carl and created a much expanded lab capacity. So our test results are able to get back in less than 24 hours. So it's even the ones that are doing at the mall, Carl is still going to do those. So that is a
Good,
really
thank you.
All right.
Thank you.
Krista, I had one comment and one question from Mr. Moody again.
Yes, thank you.
First off, Julie, I thank you for dealing with all these questions. I know we're coming at you pretty.
No problem. No problem.
You know, we really I really appreciate it. And then my second question is, looking forward towards phase 3, is, I guess I would ask personally, or as a board, are you looking forward to it, or are you afraid of what will happen as we move towards phase 3 in relation to COVID outbreaks?
I am looking forward to it. I'm not that afraid of it, because if the places do the good infection control, like I said, a case can get in anywhere. But if they don't have infection control, Rantoul Foods, you see a massive outbreak. If they have good infection control, like 20 other outbreaks we've got going on, you can contain that. And then you don't get the spread. So it's very possible. And I know that a lot of the places that we work with do a good job with what they do anyway. Of course, we don't work with, manufacturers or places like that, but we do work with restaurants, and we do work with, other places, and we know that they do a good job. So I have no reason to think that they won't do a good job with that. Whatever the next step is, I think that places will do good.
So the public should continue to be encouraged.
Yeah, absolutely. I mean, I think just the same thing with us having a lot of cases right now, but they're in younger people. What scares me is when we start getting the spread out, because somebody asked me today on a News Gazette question, why does Wisconsin not have as many cases as us? Well, the virus didn't sprinkle down on the whole US, at the same time, at the same place. It came in on flights, and it came in from people coming back from cruises, and it started outbreaks in different places. Big places like Chicago and the big cities had a lot more sparks, if you will, and then they came out from that. So other places are seeing numbers going up. The numbers of positives are not the concern per se. That's not really the concern. The concern is the number of serious cases and the numbers of hospitalizations. But the problem with the more cases you get, the more people infected, the more likelihood that you're going to have serious cases. And we've seen what they're seeing now in children, which is very concerning, and younger adults, is because what's happening to them a lot of times is their own immune system is attacking their, blood vessels for whatever reason. That's kind of unusual, but so they're having strokes and amputations and something like Kawasaki disease, and they're having all kinds of these weird things, blood clots and heart attacks caused by inflammation of their lining. That's people that are not older and sick. They're having just the opposite. They're being ravaged by the virus itself. So that's a completely different thing, but it's scary. And the more people that get infected, the more of this stuff will be revealed, because right now there aren't a ton of kids with this, but as there are, then we start seeing what's revealed by it. So, but I'm always hopeful.
Julie, this is Chris again. I want to say thank you. I'm not trying to come at you with uninformed, crazy talk, but it's just I'm being optimistic to go along with what Cody said. I want to be optimistic that hopefully phase 3, get more people back to work, opening some businesses up, that we see, I'm being optimistic that it's not going to be as serious as what everybody thinks it's going to be, just like the numbers of 1 to 2 million dying, like this all came out if we didn't shelter in place and we didn't social distance everybody's saying, you know, you can have your beliefs that it helps or it doesn't help, right? So I'm hoping that we see more, you know, positive things, people getting back to work, mental health is going to be better, people are going to be making money, being able to feed their families. So that's what I'm looking forward to. And I'm sure the other business owners are in the same mental state. Like, let's get back to work. Let's see what happens, you know? And I think people are going to be responsible. There are going to be some knotheads out there that aren't going to care. But I think the majority of people just want to get back to work, and they're willing to do whatever it takes to get back to work, to make money, to support their families.
Yeah, I
So,
think you're right. I think you're
you
right.
know,
The knotheads, as you call them, they are always the outliers, and they're always there in every situation, but they are the minority, the very small minority usually. So.
and stress a big thing. Stress kills your immune system, and a lot of people are stressed right now. So, you know, smiling faces and fresh air.
Thank you. Kyle?
Yeah, I just want to, we've been talking a lot about the economy all night, and the mentioning of stress is important. I'm an essential mental health worker, so I understand that this is what I've studied for my entire collegiate graduate career. But really, we got to remember that the economy is not some abstract concept. The economy is us. The economy is people. And if people are sick and people are dying and people can't go anywhere, we don't have an economy. We have nothing. And I think we need to remember that right now, what is expected of us, business owners and essential workers and everybody, to make sure that everybody can have jobs and get back on their feet, is just follow the guidelines. Wear your mask, stay home if you can, wash your hands, disinfect, and that'll help things move along smoother. We're an intersection of 3 interstates. And I think if we're talking about fears, one thing that I'm afraid of is if we open up and, you know, we have this direct pipeline basically from Chicago, people from Chicago who for some reason everybody's scared about with viruses and other things, these knotheads, we've seen it already in the news, they're gonna come down from Chicago. They're gonna be in our businesses. They're gonna use our services and possibly spread this further. So I understand that it's frustrating that there's no timeline, but Julie's right, the virus is setting the timeline right now. And so we just gotta kind of write it out as painful and as stressful as it can be. I feel for everybody. A lot of my friends, my parents are business owners. I understand that it's very frustrating, but if we open too early or if we don't have a plan, it's just gonna be worse. So
Pandemics tank economies. They're worldwide spread of a deadly disease. They tank economies. The policies, you know, are here or there, but there's all kinds of policies tried all the different places and all over the world. And the fact is, the virus continues unrelenting until it's done, until we get a vaccine or until we get herd immunity. That's just how it works. And you cannot get herd immunity through letting everybody get the virus, because you'll have unimaginable number of deaths, which will cause its own problems.
Thank you. Yeah. Mr. Goss, did you have a question?
Yeah, just one quick one. Julie, again, thank you for enduring this in a mask this evening. It's had to have been brutal.
It sucks.
Are you talking about as your group of healthcare professionals across the state? I know personally there are a lot of people that are uncomfortable with an untested vaccine that probably will choose not to get it. Are you starting to have those conversations?
Yeah, I mean, you know, people will, yeah, we can't do anything about that. If somebody doesn't want to take a vaccine, I think that it'll be like H1N1. We heard that a lot of people weren't going to take that vaccine too. And they were literally, you know, beating down our doors. So I'm not concerned about it. I think that some people will not take it. But then as long as you get the vast majority of the people vaccinated and you get enough herd immunity, then you can move about. There are still going to be cases and there are still going to be deaths, but I just hope to God we get a vaccine. That's my hope. But not
Yeah.
everything can have a vaccine.
Yeah, I'm concerned about that as well, but thank you. I hadn't heard that
Yeah,
talked about, so I appreciate the answer. Thank you.
You're welcome.
And then I hope that answered your question in the chat too, Cody. The vaccine, he was asking a question about the best route to herd immunity.
Yeah, vaccination is the best route because you can't just get everybody exposed to something that's has this much potential to kill so many people. Vaccine.
It's Brad
Yeah.
again.
Bradley.
Go ahead, Brad. Sorry.
And I will say the same thing as Jim. Thank you for putting up with this barrage of questions, and it's
You're
not
welcome.
anything personal. It's
I
just
know that.
I'm
You
passionate.
guys just have to know that my staff and I are we're trying as hard as we can. We're going to do what we think is the best decision, but I'm not going to go rogue.
We haven't talked
Everybody
about
thinks I go rogue on everything. I actually do not. But
something that we haven't covered tonight, and we may have a little bit on the beginning. Where are we with antibody tests? Or is that something still happening, or what?
Yes.
Where's that at?
Okay, that's a good question. Antibody testing is happening in our community. Carl's doing it. McKinley's doing it. Campus Town is doing it. The only problem with antibody testing right now, and the antibodies that we have, the testing that's being done in our community everywhere is good. It's a blood draw. It goes to a CLIA certified lab, and it's around 99 point something % accurate. So it's sensitive and it's specific. So it's a good antibody test. The ones that are not good are the point of service ones that take like 15 minutes. Those are worthless. They have like 50% accuracy. That's just not, there's no point. But the other ones, the problem, the only thing with the antibody test right now that we don't know is does infection confer immunity? So if you've been infected, so like we could all go get antibody tests, and if we knew that you had immunity, then that would be awesome, because then we would say this, we could use that in all kinds of modeling and say this whole segment, this group, get to the front lines because you're good to go. We don't know that yet. And with some viruses, like I think dengue, different ones, the first time you get it, you might have a mild illness. The second time you get it, it can be hemorrhagic or kill you. Not that I'm expecting this to be hemorrhagic, of course, but the second time is way, way worse. They don't know yet. They just don't know yet. So people can get the test, but we can't use it for planning, and you can't use it for individual decision making yet.
Do you have any kind of numbers of the amount of antibody tests that have been done, and where we stand with that? As in people having antibodies and people not.
No, I don't, because we're not collecting that. Hospital, I think they did something like 2,500. They were validating the tests and then testing the frontline staff, but it was way lower than we anticipated. I cannot remember the number. Carl has the number for their staff.
Okay.
Way lower, which did surprise all of us, actually, because a lot of us believe that there was a lot of this going around in the winter, like January and stuff, before we could ever test, January and February before we could ever test, but we can't prove that.
This is Chris again. I definitely agree with that. I believe my girlfriend actually had it.
Mm-hmm.
And it was pretty bad for a couple days. Stayed at home. But this antibody testing, I'm friends with Dr. Plura,
mm-hmm.
and he's very high on it, and he's one of them that you said's doing it the right way.
Mm-hmm.
And Pritzker has put out several times that antibody testing, it's unreliable. He doesn't have any faith in it. What is Dr. Ezike's stance on that? And have you been in contact with her to talk, or your team or whoever, to talk about these certain tests, and not your other tests? Like, is there any clarity from your side so I can understand why Pritzker is saying that antibody testing is not good and he's lumping it all together?
there's two things. So it's what I had just said. There's two things with it. Antibody testing right now is not a good tool for us in public health to make decisions with,
Okay.
because
I
we don't
understand.
know if you have antibodies, are you immune? So if we knew that, that would be awesome, and we could do a ton with that, and we would be testing everybody possible. Nor if you go get one and you find out, you can't use that to make an individual decision to say, oh, I've had this, so therefore I can go do whatever. Because if you get in, you could get infected again, possibly, we don't know. But there is a very big difference between the instant test or the, whatever they call them, point of service test. Those are not yet good. They will get good, but they're not yet. But if you get it done, like Dr. Plura does it, the Carl does it, McKinley Health Center does it, those are good, because those are a blood draw that's taken to a lab, and it's an ELISA test, which is a very, very good high specificity and sensitivity. So it's a good test. The problem is with it, I think probably the governor, I didn't hear him, but he's probably talking about, it's just not a good tool for us yet until we know what it means.
Thank you for that clarity. That's kind of what I was looking for. And it kind of makes sense with not using it towards data. But in the end, I think we could use it as data, hopefully, that everybody's probably willing to go get a little blood draw instead of get a swab down the back of their brain.
Yeah, well, there's a new one now. You can go out to the mall and you don't have to touch your brain anymore.
That's something I'm going to look into, because like I said, I am essential. I work for Ameren, so
around your nostril, and you'll do it yourself. So
yep.
Julie, I had Julie, this is Cody Moody. I had a question related to the herd immunity and the H1N1.
H1N1, okay.
So you were saying the best route is vaccination, is finding a vaccine, and you were so I guess, is that how? So I was just having the conversation with someone, and I don't know if you could enlighten me on, in 2009?
Yep.
I remember sitting in my dorm room telling my buddy, "Don't go to Mexico. Don't go to Mexico. This is scary." But then all of a sudden it disappeared. Is that how we got a herd immunity? Because I've not been vaccinated for H1N1. Has that been mixed in with the flu vaccine, or how did we get herd immunity to that? How did that kind of drop?
Did you get a flu shot? Do you get flu shots?
No.
Okay. So how that worked is that, no, it did not disappear. It actually, we had a ton of cases with that, but we did. So that year, the H1N1 came out after the flu shot. So people got the flu shot, then they got the H1N1 shot. And then since 2009, H1N1 has been a component of the quadrivalent. So that's 4 strains, or the trivalent, which are the 3 strains. It's in that every year. H1N1 is in that every year. So between the infections, because a lot of people were infected before, but the good thing about flu, or with that, is at least there is a treatment for that. It doesn't work for everyone, but if you get infected with flu, you can take a Tamiflu, an antiviral, and it lessens your complications. And the flu, the H1N1, everyone everyone born before 1954 had some immunity to that, but everyone before that was what's called naive. So they were getting it, and they could get serious complications with it, especially kids were having a rough time with that one. So herd immunity came, anytime you get a vaccination, that's when you can get herd immunity.
So herd immunity does not come from everyone just getting exposed to it. No. Naturally, it comes from vaccination.
Correct. Yeah, I mean, in theory, it could come from being exposed to all of it, but a ton of people would die from that.
Thank you.
Thank you, everyone, for a really robust discussion. Thank you for your questions, your concerns, your comments. They are taken at heart. I want you to know that we are listening and are being very proactive in responding to your issues and concerns. So again, thank you for bringing all of the wealth of information that you've brought tonight to our attention. Any additional questions from the Board of Health members for Julie? Okay, hearing that, I'm going to move us on in the agenda to public participation on non-agenda items. And our only agenda item this evening was COVID-19. So is there any public participation on anything not related to COVID-19? Okay. Hearing none, that takes us to any additional business, and the last order of business is our next meeting. So our next meeting is scheduled right now for June 16th. I'm going to propose the possibility of meeting in 2 weeks on June 1st. That would be immediately after the ending of the current executive orders, so that we could address any potential issues or concerns. I wanted to propose that for the board members as a possible additional special meeting date like we've done this evening. What say you?
That's a good idea.
Agreed.
Okay. Hearing no concerns with that.
Wait, Dottie's talking, but she's on mute.
Dr. Vera Weiss, please.
So that will again be on a Monday evening?
Yes, that's a Monday evening at 5:30, June 1st at 5:30. Thank you. That would be what I'd be proposing. And then we would have our regularly scheduled board meeting with the budget and all of the other information on June 16th.
And I think as part of that discussion, based on everything we heard here tonight, that we would want to make sure that we cover the topic of at least sort of getting an update about the businesses and the guidelines that some of the business, I realize that's not our role, but I think we have a role in knowing that was it coordinated with the public health guidelines.
Right, and what's going out. I agree.
Right.
We have a role in knowing what's going out to them.
And a request, hopefully made in the right spirit, that we can all be working together. You who are involved in county government leadership, if you could help us, I mean, we were criticized tonight for not helping to prepare the county businesses for how you reopen. And that's when we've tried to comment on how people conduct their businesses in the past, we've been criticized for being government that's trying to take over businesses. I hope that when we come and talk about the rules that should apply when you reopen your business, that it will be met with a spirit of, we're really in this together. We want those businesses to be open. You can help us do that.
Absolutely. Absolutely. Thank you, David.
By the way, that was one of my disappointments that the county board didn't move all the money over, because some of the money that we wanted to move over is for helping businesses reopen. I mean, the public health aspects of that. And so you don't immediately think it's just government trying to tell businesses how to run their business.
Thank you. Okay, so that will set the next meeting for June 1st at 5:30. Amy, if you can get us a Zoom link, and then the only agenda item again will be our COVID-19 update. Hearing no other questions or concerns, I'll entertain a motion for adjournment.
Seconded.
Moved by David, seconded by Dr. Vera Weiss. Any discussion? Hearing none, all those in favor?
Aye.
Aye.
Any
Aye.
opposed? Any abstentions?
Thank you, everyone.
Once again, thank you everyone for your time and for your participation. It's greatly appreciated.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.